Welcome everyone to another wonderful episode here, Jaws Podiatry. We're here in our office-based surgical suite, and today we're going to be performing a very unusual, atypical case. We're going to be shortening the second toe of the right foot. Why is it atypical? Because the left one is perfectly fine. And historically, we see the Morton's type toe in both the left and the right foot. So, the patient presented with, a little bit of discomfort. And of course, the patient is not happy, am I correct? With the appearance of the second toe, that it is longer than all the others. So we're gonna rekindle, so to speak, that symmetry of both second toes. So today's a very special day. In addition to that, I want everyone to look at the lateral side here. I want everyone to look at this little pouch on the side of the toe. In individuals or patients that have the long second toe, the Morton's type toe, we see, I would say easily 85% of the patients have this little pouch of adipose tissue. It's fatty tissue. So what I like to do is to give the toe a more natural appearance is we do a little debulking. So let me see if I can show you guys here. We thin the toe just a little bit by using plastic surgery techniques. So again, it gives the toe an appearance as such. Kind of like a little bit this one, even though this one it's going to be very, very, very mild. So that's exactly what we're going to be doing today. I'll definitely post some before and afters as well. And I will definitely keep everyone afloat on this patient's progress. But again, it's a very atypical case because it's only unilateral. Only one foot, the right. We're going to be shortening the right second. As always, www.jawspodiatry.com, Instagram, Dr. Tojan, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Welcome back, everyone. So we're all done with the two procedures. Everything went great. So, I do get a lot of questions throughout all of our social media platforms about toe shortening surgery. I just wanted to answer just a couple of them. So there's different, and it really depends on the clinical presentation, right? Not all toes are created equal. Whether it's, toes that are very, very long, toes that may be a little bit shorter, and then there are toes, like in this particular case, that are even a little bit shorter, right? And that really dictates what procedure or what procedures we do. Whether it's an open procedure, whether it's a hybrid, what we call a hybrid type of procedure, or simply a minimally invasive one-stitch procedure. And again, how do we decide upon that? And that basically boils down, again, to the clinical presentation. If we need to fix an overriding second toe that's also long that we need to shorten. There's so many variables, and that's how we decide which one, and again, I don't mean to repeat myself, but that's one of the, I would say one of the main questions that we get here at Jaws Podiatry in respect to toe shortening. We don't use any type of internal fixation, what we call internal fixation, no screws, no pins. You know, I'm going to show you guys now, you know, how this is one of our techniques. This is what we call a splinting technique that will hold, you know, the toe in its proper anatomical shortened position. You guys can clearly see the difference now in the shortening of the second toe, right? It's relatively clear. And what I'd like for Sebastian to do is show the left one. So let's put these, patient, can we put your feet together just so everyone kind of gets a, so again, this was a very atypical case. It was unilateral, only one, you know, it was only the right second toe that was really, you know, it was quite long. And then usually it's bilateral, but in this particular case, it was only one. So we only addressed that. And then I want everyone to see, when we talk about the toe tuck, or what we call the debulking, right? Come around here. Sebastian, let's show everyone. There are 3 tiny little stitches here. And basically, see, there we go. So that's the little incision that we made to kind of thin out, to debulk, to thin out that little pocket of fatty tissue. And that gives the toe a very natural appearance once everything is healed. Okay, and that's the reason why we do that. We decided, even though she has a little bit of it, and I want to, let's show, this is what I mean. You guys see this? Let me just put a little bit of weight here, there. You see how you have this accumulation there? So we basically just ever so slightly take a little bit and of that tissue, so we can actually give the toe a little bit of more symmetry. Again, beauty and function, that's the key here. And we will continue the buddy splinting process for several weeks while the area heals. The patient is wide awake. This was all performed under local anesthesia. Would you like to say anything? How was your experience?
It was good. I felt nothing, no pain.
Okay.
Yeah.
Okay, great. You know, this is, I always say, this is day one of one.
Mm-hmm.
So, you know, we do have several weeks ahead. I call it the 90-10 rule. You know, 10% is what we just did here. 90% is what the patient invests into the program, right? Whatever you put into the program, that's what you're going to receive in return. A really nice outcome, which is at the top of the list, right? We focus our efforts on outcome. If anyone has any questions, please feel free. I will post this video. I'd like to add, a lot of our subscribers have been asking before and afters, and a lot of the before and afters of any of the procedures that we do in the world of minimally invasive foot and ankle surgery, we post in our Facebook fan page. So go to Doctors of Podiatry, foot and ankle specialist, give us a like, and you'll be able to scroll down and see. We do post a lot, so just giving you guys a heads up that you'll have to really scroll down and to find those before and afters. And we also do a lot of vlogs there that I think a lot of people will enjoy. So for those individuals that are seeking, you know, solutions in the world of either toe shortening, anything related to the minimally invasive procedures, it's all in our Facebook fan page. As always, www.justpodiatry.com, Instagram, Dr. Toe Jam, Just Podiatry, Facebook, and last but not least, our YouTube channel, Just Healthcare. I will definitely keep everyone afloat on this patient's progress, just like all of the other patients. And the patient today is Friday. The patient will be back on Monday, and then we'll do another video. Have a wonderful weekend, everyone.